Good afternoon, everyone. We wanted to provide you with an update of the latest information on the COVID-19 outbreak in Arizona. This morning, our state public health lab confirmed the third case in Arizona. This is the second case that was confirmed by our state lab. While the case investigation is handled by our local public health partners who are the experts and the boots on the ground, we wanted to be able to provide you with what we know right now. The latest case is a female in her 40s who is a Pinal County resident and is currently hospitalized in Maricopa County. Public Health is investigating this as the first case of community spread in Arizona. Community spread refers to the spread of an illness for which the source of infection is unknown. I'm going to defer specific details to Maricopa County and Pinal counties because they're the frontline boots on the ground and their staff is currently doing the investigation. But as we mentioned in our news conference, we're expecting to see more community spread in Arizona, which is why it's so critical that Arizonans follow our prevention guidelines. So the best ways to prevent COVID-19 and other respiratory illnesses, this also works for influenza, but to avoid close contact with people who are sick, avoid touching your eyes, nose, and mouth, stay home when you're sick, cover your cough or sneeze with a tissue and then throw that tissue in the trash, clean and disinfect frequently touched surfaces, and you want to do that doing regular household cleaning sprays or wipes, and wash your hands with soap and water for at least 20 seconds. If you don't have soap and water, make sure that you are using an alcohol-based hand sanitizer. We recommend that those who have recently traveled to an area that has ongoing COVID-19 transmission, and if they develop a fever, cough, shortness of breath within 14 days of their travel, or you've had contact with someone who is suspected to be infected with COVID-19, stay home and call your healthcare provider. If you don't have a healthcare provider and you need to go be seen at an urgent care or an emergency department, please call that facility before showing up so that they can take appropriate precautions to keep you away from other patients and to protect their healthcare workers. So we are currently monitoring 256, or that's the cumulative, 256 returning travelers to Arizona. We have 14 persons under investigation, so taking a look at if they meet the criteria, and we have ruled out 33 people. So some of the things that we're going to need to know is like days that they were seen in healthcare institutions. Where were they? What other close contacts have they had? Have they been in other counties? Because we will do the cross-county collaboration. So we'll coordinate that from a statewide perspective. They'll be responsible for the day-to-day epidemiology work, talking to the patients, getting tests coordinated, and those types of things. And then we'll help coordinate interjurisdictional issues. So they are currently, we got this information very, very late. We have been investigating this from the moment that we heard. So Pinal County and Maricopa County are still actually gathering some of that information so they can have it for you at 1:30 today.
About the other patient and the second patient number 2, let's put it that way, all right? Patient number 2, the man. What can you tell us about him?
So what I know about that individual is that he is a contact of a presumptive positive in Florida. And so he had
contact.
I believe they traveled together. And so I had heard Milan, but we were notified because he was an Instagram picture. But we're trying to make sure we're getting you the information because having a possible community spread is different than just having travel-related cases. And that's what we want the public to know. It's really important to make sure you are taking those precautions, the hand washing, covering your cough, staying away from people who are sick, because we do know it's in the community. We expect, especially watching what's going on in other parts of the state, to identify additional cases and more community spread.
What's the projection on the number of cases and how that will increase?
I would expect, numbers are a little bit hard, but I would expect this to look like a bad flu season. So right now with influenza, we're at almost 28,000 cases in Arizona, and those are just the tip of the iceberg because those are just the people who went and got tested. We will likely see a large number of cases because no one's ever been exposed to this virus before.